It's Thursday, October 31st, and this is the Daily Medical News, where we bring you clinical medicine's top headlines, as well as an in-depth look at today's biggest story. I'm Mary Ellen Schneider.
And I'm Nick Andrews. Today, the net prices of drugs are rising 4 times faster than inflation.
What you need to know about the risks and benefits of prescribing benzodiazepines.
A federal judge blocks Alabama's near-total abortion plan.
Biologics aren't driving older psoriasis patients increased infection risk.
Plus, the evidence is clear. Flu vaccination leads to fewer severe infections. But first, help us make the Daily Medical News a little better by completing our short listener survey. You can find the survey via a link in the show notes. And now, the news.
The net prices of drugs are increasing 4 times faster than the rate of inflation, despite being offset 43% from list prices. List prices increased 232% from 2007 to 2018. That's 12% per year. And net prices increased 133% during the same time period. For Medicaid, the gross to net discount increased from 40% in 2007 to 68% in 2018. For all other payers, the increase was 22% to 50% during that same period. Researchers from the University of Pittsburgh reported the findings at the annual meeting of the Academy of Managed Care Pharmacy. The investigators also found a wide variation on discounts across therapeutic classes. For example, list price for drugs in the multiple sclerosis category increased 407% over the study period, while net price increased 221%. Insulins came in second in terms of gross price increases at 337%, but their net prices increased only by 83% because of increasing discounts.
What's the right role for benzodiazepines, which seem to be both widely used and misused? Psychiatrists Rakesh Jain and Stein have an answer. Tread carefully, but don't eliminate them as an option. Speaking at the annual Psych Congress, Dr. Jain of Texas Tech University in Midland, Texas, noted that benzodiazepines are popular, and for good reason. Many patients use benzodiazepines chronically, and they're doing it right. On the other hand, the medications are linked to addiction and physical dependence. Dr. Jain estimates that 30% of those who die of opioid overdoses may not have died if they didn't have benzos. Dr. Stein of the University of California, San Diego offered some tips for prescribing benzodiazepines for patients with anxiety. First, be very cautious about prescribing as needed. That can lead to patients taking them either too late or preemptively too soon. And don't use them as patients start on SSRIs. Patients can get anxious as they start SSRIs, especially for panic disorders. So a prescription may seem appropriate, but benzodiazepines can be hard to stop. Instead, Dr. Stein prefers to help patients understand possible side effects of SSRIs.
A federal judge has temporarily barred Alabama's near-total abortion ban from taking effect. In an October 29th decision, Federal District Court Judge Myron Thompson wrote the plaintiffs are likely to succeed in proving that Alabama's law violates a woman's constitutional right to obtain a pre-viability abortion. He added that enforcement of the law will cause irreparable harm to Alabama women. Alabama's measure bans abortion at every pregnancy stage. It penalizes doctors with a Class A felony for performing an abortion and charges them with a Class C felony for attempting to perform an abortion. The law includes an exception if a woman's life is at risk, but not for cases of rape or incest. The law was scheduled to take effect November 15th. Judge Thompson halted the measure while the lawsuit continues through the courts. We'll be back after this message with more medical news.
Psoriasis patients aged 65 years old or older are at more than twice the risk of serious bacterial and opportunistic infections compared with younger patients. But being on biologic agents doesn't elevate that risk any further. Researchers at Brigham and Women's Hospital in Boston found that among the population of senior psoriasis patients who never used systemic therapy, the risk of serious infection was more than twofold greater than that of matched controls without psoriasis. The researchers also analyzed 3 groups of older patients and matched controls. The 3 groups included newly initiating biologic therapy, others newly initiating non-biologic systemic agents, and seniors starting phototherapy. The primary study endpoint was the rate of serious bacterial or opportunistic infections requiring hospitalization during the first 6 months of treatment. They found that infection rates were closely similar across all 3 groups, with the most common serious infections being pneumonia and cellulitis. The researchers presented their findings at the annual Congress of the European Academy of Dermatology and Venereology.
Influenza vaccine cuts the incidence of flu and mitigates infection severity, both in children and adults. During recent U.S. flu seasons, children and adults who contracted influenza despite vaccination had significantly fewer severe infections and infection complications compared with unimmunized people. That's according to 2 reports from CDC researchers presented at ID Week 2019. One of the reports tracked the impact of flu vaccine in children using data that the CDC collected at 7 medical centers. The researchers analyzed data on 3,600 children aged 6 months to 17 years hospitalized for an acute respiratory illness during the 2016 to 2017 and 2017 to 2018 flu seasons. Dr. Angela Campbell is a CDC medical officer. She says the results demonstrate the benefits of vaccination.
We really found a nice benefit from vaccination, and this was in children both previously healthy and children with underlying medical conditions.
A second CDC study looked at data on adults at least 18 years old who were hospitalized for a laboratory-confirmed influenza infection. Those data covered 5 flu seasons, from 2013 through 2018. The results show that hospitalized 18 to 64-year-olds who'd been vaccinated for the flu were 36% less likely to die than their unvaccinated counterparts. Their need for mechanical ventilation was 34% less, and they were 20% less likely to develop pneumonia. What's the take-home message for patients and physicians? Dr. Campbell says it's clear.
The implications are that we know vaccination can prevent illness, but we also know that it can prevent severe illness, and coverage in children is not what we'd like it to be. I think the public health message we'd really like everyone to hear is that all children and adults, everyone 6 months and older, should get an annual flu vaccine because it can prevent both influenza illness and severe outcomes from influenza.
And that's it for today's Daily Medical News. Be sure to catch the newest episodes of the Dermatology Weekly and Blood and Cancer podcasts, available today and every Thursday. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. Remember, you can find the Daily Medical News on Amazon Alexa, Apple Podcasts, Pandora, YouTube, Spotify, or wherever you get your podcast. Thanks for listening. We'll see you tomorrow with the top stories in clinical medicine.